Hello, this is Janet Michael. In addition to hosting the Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to the Valley Today. I am your host, Janet Michael. Happy Thursday. As you are listening to the show today, it is Community Health Day in partnership with Valley Health. We do this on the third Thursday of every single month, and this is where we talk about all aspects of health in our community. We talk about Valley Health programs. I've talked to administrators and cardiologists, and I don't think I've had any brain surgeons on. Terry, you may have to help me get a brain surgeon on. I don't think I've talked to anybody in that particular area yet. But today we are talking about the nurses, one of the biggest resource that Valley Health offers us. And I want to say too, before we dig in too deep to the year of the nurse, I want to thank all of you on the screen. Terry Mays is here with us. She is the Chief Nursing Officer at Warren Memorial Hospital. Terry has done the show with me a couple of times. And Terry, thank you. I want to thank you and all of the Valley Health team, because you guys have been invaluable to me doing the radio show and to me personally during the last 18 months of this pandemic. It has been so amazing knowing that I have a credible source of information to go to when I hear something. Dr. Fight and I have become quite good friends, and I am so grateful to what Valley Health has done to try and keep this pandemic at bay and then deal with it as we've moved through these last 18 months. So thank you. And I want to thank the other ladies on the screen. I don't know them personally, but we're going to be great friends by the time we're done recording today's show. We are chatting with Sharon Rigney. She is the Associate Chief Nursing Officer at Winchester Medical Center. Ann Whiteside is joining us as well. She is the Chief Nursing Officer at Winchester Medical Center. So Terry, I want to start with you, and I know you've explained this before, but exactly what is a Chief Nursing Officer? What does that mean?
There is a requirement that nursing services be led by a nurse, and that there be a Chief Nursing Officer that oversees nursing practice, nursing policy, and procedures. So it just means that there is someone in that leadership role at each of our entities. And that's an important component, because while we really do support autonomy in nursing practice, and we need and really rely on bedside nurse input, there needs to be a leader of those efforts in order to be able to advance the practice of nursing.
And I may be wrong in this respect, but I would guess that the nursing staff at Valley Health probably outnumbers the doctor staff by quite a large percentage.
Absolutely. Nursing is the largest single profession, not only within Valley Health, but any healthcare system, because we're here 24/7 and we're having interactions with almost every patient that is seeking healthcare, particularly for emergency department and inpatients. But also nursing practice is very broad in scope. And there are a lot of areas that people wouldn't imagine where nurses are providing care.
So I want to start with you, Ann, as Chief Nursing Officer at Winchester Medical Center. How did you get started in nursing? Did you decide you wanted to be a Chief Nursing Officer when you started out? What made you decide you wanted to be a nurse?
Well, first of all, the opportunities within nursing are just infinite. So as a young person looking for a career, I wanted to make sure that it met with what I hope to achieve in life, both an individual as a career, but also as a citizen. And I will say that in my many years of nursing, it has done that plus. And the gifts back to me in my many different roles have been extraordinary. So I know I had no idea even what a chief nurse was. And I started out in a NICU role. I wasn't very well suited for that. And a very wise person directed me to another area. So I worked in brain and spine for a long time, including research, and then moved into management roles. So I would say that my career is probably like many, that we don't have a straight shot direction to where we start and where we end up. But that's one of the beautiful things about nursing, is that you can try and explore different things, match it with your life and lifestyle. And it has been an extraordinary journey for me. The chief nurse role is a privilege. I think that Terry and Sharon would agree that although we don't take care of patients anymore, we do apply all those principles, certainly within our heart and all of our talent, to take care of the caregivers that take care of our patients. So for me, that is the most gratifying piece of this role, is to be able to support caregivers to do their very best and feel the very best in their efforts to take care of patients and families.
And you bring up a good point too, Anne, because I think sometimes from the outside looking in, us as the general public, we think of you as in this general term based on what we see on the TV shows, on ER or Chicago Med, and we just see nurses in a particular role. And we forget sometimes that you can be specialized and you can find a different path all within nursing. You're not just a nurse, which seems crazy to even say out loud that way now.
It is, and I think that goes to Terry's point. Unlike some of our colleagues, nursing is the broadest of all of them. And so you can actually use your nursing talent, which has some elementary or fundamental skills, and apply them in ambulatory settings, in research, in things like utilization review, making sure that patients are in the right setting, triage functions. So the opportunities are very, very broad. And there's so many roles that I think the public is not aware, where nurses actually are foundational in providing access to care, supporting people across the care continuum, and roles in hospital-based care is now provided pretty much in the homes. So I do think that there's a little bit of a lack of understanding and awareness for all the different values that nurses bring to care across the continuum.
Sharon, what made you decide to become a nurse? What has your path been like?
You know, these stories also resonate with me. I started my career as an LVN, and when they offered a trade school option in high school, my guidance counselor said, "Wow, Sharon, you've got to do something with yourself. You can't just sit in study hall." So I started as an LPN very early on, and it's been 28 years for me now in nursing, and a lot of my experience has been within women's and children's, and I think it really expands and kind of solidifies where there's many, many opportunities and many pathways. Women's and children's has been my passion, and I'm currently in our inpatient acute care areas. And just the opportunities of being raised by my father, who taught me that to what I've been given, much I owe back to the community. And it really, for me, is taking care of the people. And what that means is, how can I give back, either in a big way, a small way. And the profession of nursing is truly one of the professions that is trusted the most. And to have that honor of taking care of someone's loved one, someone's child, someone's mother, father, aunt, uncle is such a blessing to me. And to see our colleagues do this in and out every day, it's why I do what I do.
And I talked to so many friends and family that have had stays in the hospital, stays at Winchester Medical Center, War Memorial, Shenandoah. And so many times they know who their doctor is, because obviously you always know who your doctor is, but they rant and rave about the nursing staff and the care, because that's who we look to when we're in any kind of a setting like that. We look to the nurses to actually take care of us. Sometimes the doctors kind of get pushed to the background because, yeah, they did the important stuff, but what really matters is getting me better, getting me out of here, and getting me back to life. And a lot of times that falls squarely on the shoulders of the nurses that are taking care of a patient.
This is an area of importance to me. So I think that a lot of the care is prescribed by physicians and advanced care providers. But for the others, the nurses, the respiratory therapists, et cetera, they are the promise keepers for the care. So patients don't get better unless we actually complete the care. And most importantly, for us to incorporate the voice of the patient and family and tailor the care when perhaps maybe it's either not feasible or they're not willing. So I do think that there's a whole host of care providers obviously we're biased towards nursing, that are the promise keepers to make sure that the plan of care actually is executed to the very best that it can be, obviously including the willingness and ability of the patient and family.
And I love that you have the broad ability to change where you are. And you touched on this, as did Sharon a few minutes ago. My mother-in-law is, I guess you're never really not a nurse anymore, are you? You're always a nurse. She's our medical go-to in our family now because she's a nurse, but she was a nurse in the NICU at Winchester Medical Center and retired a couple of years ago. And I can't imagine June as any other kind of nurse. That just is kind of her thing. But I talked to a lot of students at Lord Fairfax, many of them going through the nursing program, that thought I couldn't be a nurse until I found out that I still could, just doing it differently in another way. And I think so much more education needs to go out there to people to realize, don't shut off the career, just look for a different pathway within the nursing career.
And I'd say absolutely, because of the breadth of nursing practice, I don't think any one of us on this call today would be able to list for you every opportunity available to somebody wanting to pursue a career in nursing. The field is so broad and it offers so many possibilities, from working in an executive management position, as the three of us are, or being bedside with hands-on care of a patient, to working behind a computer doing utilization review, as Anne referenced earlier, just making sure that the patient's in the right care setting are receiving the appropriate care at this point in their health journey. So I think that it pays to have an open mind when you look at nursing and to explore.
Well, let's take a quick break. When we come back, I have a question about magnet nurses, because I see this a lot on TV, magnet nursing program. And I've always wondered what that meant. And I assume it's not that you guys carry magnets around in your pockets so that you can find each other in the facilities. Can we talk a little bit when we come back about the magnet nursing program and a little bit more about what's changed since becoming a nurse to what you're experiencing on a regular basis now?
Sure.
When we come back, we're going to continue our conversation. We are pre-recording on the screen today with Terry Mays. She is the Chief Nursing Officer at Warren Memorial Hospital. Joining her is Ann Whiteside. She's the Chief Nursing Officer at Winchester Medical Center. Sharon Rigney is on the screen with us as well. She is the Associate Chief Nursing Officer at Winchester Medical Center. It is the year of the nurse. We're going to talk about that some more when we come back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. It is Community Health Day in partnership with Valley Health, and it is also the Year of the Nurse. So the World Health Organization and American Nurses Association deemed 2020 the Year of the Nurse. It has been extended through 2021, but I think we're all still living in 2020 until we get through this pandemic and are squarely on the other side of it, which Dr. Fight pointed out to me several weeks ago, we are not, and gave me quite a bit of grief for assuming that we were. And I don't know, ladies, that many of us would have gotten through as far as we have, if not for the nursing staff at Valley Health. Health. So thank you all for your hard work and your dedication. We are chatting today with Terry Mays. She is the Chief Nursing Officer at Warren Memorial Hospital. Ann Whiteside is the Chief Nursing Officer at Winchester Medical Center. Sharon Rigney is the Associate Chief Nursing Officer at Winchester Medical Center as well. And when we went to break, I was joking about the magnet nursing program because I watch Channel 4 News and they have hospital systems that do the commercials. We're a magnet nursing program. They made it sound like it was a really big deal, but I didn't know what that meant. And is it really a big deal that Winchester Medical Center is a magnet nursing program?
Well, yes, it is a big deal, and it's a lot of work and intention on behalf of all the nurses in the organization and obviously Valley Health as a system. And no, we don't walk around with magnets in our pockets, as you suggested. It actually now, I was just reflecting, this program is over 30 years old, and it's sanctioned by the American Nurse Credentialing Committee, which is a part of the ANA, American Nurses Association. Magnet actually was the origin of researching a select group of hospitals in the early 2000s to figure out what made them unique. And they found there were a few elements which were in the early days named as the forces of magnetism. And that's where the word magnet came from. This was what kept people, nurses, at their organization and functioning at such a high level. So that was the early origin. It has matured and transformed over the years into a highly rigorous, data-driven application process, which it's sort of the underpinning of that original idea of what keeps nurses at an organization and functioning at the highest level. So there's 6 major components, but the big ones are nurses really have to have a voice. And so there is a commitment of the organization to provide a structure for nurses to use their voice, participate with decisions closest to where they do the work, having very strong leaders that enable that. So you need people that are forward thinking, innovative, allowing people to sort of say, well, let's try it, and using data to guide, making sure that we're purposeful and intentional. So that's the organizational commitment that we provide that. But the culture is, how do you actually create an environment where nurses are welcome to participate in how we design and deliver care and to use their voice to the full level as possible. Now it's a little bit more interdisciplinary, so it's actually maturing out of the nursing realm. It used to be sort of confined just to nurses. Not true anymore. So most of our committees now have physicians and respiratory therapists and pharmacists, et cetera. So it is really making sure that the clinicians that are entrusted to provide the care are also entrusted with how we design and deliver the care.
I was going to ask you how the term magnet came to be, which is genius, actually.
It used to be softer, and it took some hits. A lot of people felt that it was just pretty pictures and pom-poms. There's a lot of celebration, but today, actually, I think we need to submit, in our last application, 99 sources of evidence to prove that we were worthy of even submitting the application. And this is data. This is actually proof that what we set out to do, we did. We made improvement. And some of the data is actually, as many people know, there's a lot of research going on in healthcare and true also for nursing. So how are we actually making nursing or healthcare better by contributing to the body of knowledge? And that's really what distinguishes magnet organizations. In Virginia, we actually have a pretty high number of magnet organizations within this state. I think it's up to 7% now are magnet organizations. And I'm not sure that it includes the international ones. But it takes a lot of work, a lot of effort, and you can't sidestep or cheat this. You actually have to do the work. And the 3 main areas are nurse engagement. How happy are the nurses? And do they really feel that their voice is heard? And do they have professional opportunities? How well do we take care of patients and families? And that's based on the patient's perception of care. And then there's some nursing sensitive indicators that are the hallmarks for really good nursing practice. How do you present harm and complications? And again, that's all compared to national sources. It is pretty vigorous and requires a lot of work on the part of nurses and the organization.
Terry, Ann kind of laid out all of the things that go into being a magnet hospital. I would guess that Warren Memorial Hospital, you guys are one of 9 Pathway to Excellence hospitals. That probably is because you're not the size or have the staffing levels that Winchester Medical Center does. But this Pathways to Excellence is a big deal as well.
Oh, absolutely it is. I think the ANCC recognized that not every hospital would be able to meet the criteria for magnet hospital. So the Pathway to Excellence program was established much later in 2007. So it has not been around as long as Magnet has, but it's been around long enough now that there are more pathway organizations across the country that are joining. In fact, when we were initially designated 3.5 years ago, we had to wait in line because so many other organizations were applying as well. Some hospitals will choose to apply for pathway designation first and then apply for Magnet later. And those are hospitals that will meet the criteria, but they want to cut their teeth on that something, because it is, as Ann said, it's a rigorous process. There are no shortcuts. You actually have to do the work. And so the pathway designation initially is a stepping stone into the Magnet for some, but for Warren Memorial, the pathway is our final destination. We're coming up for redesignation this coming summer. I will say from my perspective as the chief nurse leader at Warren, it has been the greatest team building experience of my career because it really focuses on what makes your organization a good place for a nurse to practice. The 6 standards for us include shared decision-making, meaning that nurses have a voice in their practice, leadership, meaning that the leaders of the organization are promoting good nursing practice and supporting that, safety, quality, those cornerstones, good healthcare, nurse well-being, and professional development. We at Warren have a true interdisciplinary shared governance model. And so currently our overarching coordinating council is led by a physical therapist. We have a separate nurse practice council where the practice of nursing issues are addressed. But we have respiratory therapy, med technicians, imaging technicians, et cetera, also at the table to have these interdisciplinary discussions about what does good healthcare look like. And that's, from my experience, that's where our best work has come from. That's given us the good outcomes.
I know from several of the conversations that I've had with some of your counterparts, Terry, the amount of input that nurses were asked for and allowed to give during the building of that new hospital, which traditionally most people from the outside wouldn't think, well, why would they ask a nurse what they want to do with a particular building? But there was a lot of input that was gathered, and they wanted to know how to put this hospital together in the safest, most feasible way from the nursing staff on down.
Yeah. I think every nurse that has practiced for any length of time has been in a facility where nursing did not have a voice in the design and immediately found things to improve upon. And so we decided to be more proactive rather than reactive, and to invite our nurses to the table, as well as our other interdisciplinary colleagues, to ask what makes sense here? What is the most efficient? What promotes good, safe, quality care?
So Sharon, pandemic aside for a second, what's been the biggest change that you've seen in nursing since you started this career?
I think the biggest change is just the growth in the profession and nursing always being at the forefront of the latest technology, the evidence base. Our nursing careers very early on were team-based approaches where we had a mixed model of care. That has changed for us over time. We've learned many things about our ability to be creative, our ability to create new standards and processes, and how we care for our community, both through access, through the acute care, and into resources outside in our community. I would say the biggest change for us, the pace and flexibility. You know, there's not a lot of guarantees, but the one guarantee we've learned is change is always upon us. And how we can come together as colleagues and teammates in delivering that care. It's certainly been a very, very atypical year, but the one thing that hasn't changed is the core character of a nurse. I have never seen such teamwork be so powerful, along with many observations of the utmost commitment and bravery that I've seen during these times of uncertainty. So what a year it truly has been for all of us here at Valley Health and across our community.
So, Ann, right now, I would guess, based on everything that you guys are talking about with the voice that nurses have, the wide range of options that they have once they decide that nursing is the career path they want to take, it is also highly sought after. I mean, you guys at Valley Health, I'm sure, are looking for nurses all the time, whether we're in a pandemic or not. So this is another great opportunity for somebody to reconsider and reach out to one of our local colleges, or even come to the hospital and say, hey, I think I might want to be a nurse. What's involved? Is that possible for people to do?
Oh, it's a great question, Janet. Yes, the nursing opportunities are just expounding every single day. And therefore, we are always recruiting for the right people to take care of our patients. In the hospital setting, these are the most frail and vulnerable patients. So getting the right people in the right spot with the right heart is really important. So I think a couple things. Yes, I think this is a great time to explore. And we have so many really strong academic partners here that have actually tailored their programs. We work really closely with them to make sure that the education is current, it's flexible, it's relevant. And so this is a great time to reach out to any of the academic partners. Valley Health is a tremendous amount of support for people that want to move from a clinical but non-licensed position. So if you want to be a certified nursing assistant and then work your way into a registered nurse position, we provide tuition support, laptop support, adjusting the schedule. So it is a great opportunity for people to explore nursing at the pace that they can. So I would say definitely this is a time to either take a non-licensed position and get into healthcare, or go right in through the academic setting and explore nursing through either a community college or any of our other academic partners.
Any regrets? Do any of you have any regrets looking back over your career thinking maybe I'd have been better off as a teacher?
You know, Janet, I would say no. I don't have regrets. Each day is a different day. It's not the same. It doesn't repeat itself. Those moments of joy that fill my cup really are the people that I work with, and the many opportunities and interactions I get to have with not only colleagues, but patients and families in our community. I would do it all over again.
The reality is this profession attracts individuals that care. That's why we're called the caring profession. And where would you rather work than with people that care? I mean, it is because they not only care about patients, we as nurses care about each other and all of our healthcare colleagues. And at the end of the day, that makes it a really great place to work and be a nurse.
Well, I will write a letter to the World Health Organization and the American Nurses Association and ask them to, instead of doing the year of the nurse, we just do the decade of the nurse, because I think all of you deserve that plus more. So thank you for taking some time to meet up with me on the screen today and have this conversation. I appreciate all of the work that you guys do to keep all of us healthy and safe.
Thank you for the opportunity.
Thank you.
I will be back tomorrow. I will have a brand new episode of the Valley Today ready to go for you just a few minutes after noon. I believe we are talking with some Shenandoah County 4-Hers that are going to be showing in the Shenandoah County Fair coming up in the next couple of weeks. So meet me back here for that tomorrow, just a few minutes after noon.